Our first speaker of the day will be Dr. Anjli Doshi-Gandhi. She and I were discussing, I think her position was a lot like the counterpart position that I had in the USA until January, when I worked for the Administration for Children and Families at the U.S. Department of Health and Human Services. So I'm delighted to introduce Dr. Anjli, who is the Deputy Director General of the National Population and Family Development Board in Malaysia, Ministry of Women, Family, and Community Development. She's had more than 30 years experience as a trainer and educator in the areas of marriage, parenting, and family life. So will you join me in welcoming Dr. Anjli?
Thank you very much, Diane, for the introduction. Diane Dawson, the moderator for this session, my fellow panelists, distinguished delegates. A very good afternoon to all of you. Good afternoon. Hope you had a good lunch. And usually they say this is the most challenging session. By looking at all of you all, I think we'll have a very interactive and interesting discussion. First of all, I also like to take this opportunity to thank the organizers of this Global Peace Convention 2013 for having invited me on behalf of my organization to share our experiences on how globalization impacts the family institution, Malaysia's experiences in strengthening families. As we all know, over the past decade, especially with reference to Malaysia, rapid transitions in families have taken place due to globalization, urbanization, the development, industrialization, etc. And there's so many changes that have happened in our families, especially in the context of Malaysia. Recognizing that families have undergone and continuously experienced change in response to the globalization process, and the impact of it has been widespread as far as Malaysian families are concerned. We do admit that with globalization and ICT development and all that, there's better communication with members who can be anywhere, and in that sense not physically present. However, never have changes been so rapid as we now live in a borderless world where development in the external environment can immediately impact on the personal lives of families. Globalization in general brings advantages and positive changes to families, but it also creates risks and conflicts that must be anticipated and adapted to. Ladies and gentlemen, the spread of globalization will undoubtedly bring changes to the countries it reaches, but changes are inevitable and an essential part of life. The complexities of modern living can make people change their perceptions towards marriage and family, choices of whether they want to get married, when they want to get married, career choices, work-life balance issues, etc., which are partly due to the effects of globalization. But families, we have to confront these changes and learn how to cope and deal with the challenges of globalization and development. So hence my presentation will be more on some of our experiences and what we have done to address these challenges. Many of these transformations due to globalization call into question the very structure and sustainability of society as we know it. They require us to work together to strengthen families and to address the needs of families to ensure family and societal well-being. There's a need to build an environment that sustains and supports families while reinforcing the opportunities for fulfillment that strong and positive family life provides. Basically, ladies and gentlemen, my presentation will focus a little bit on the demographic profile of Malaysia to give an idea of the type of challenges that we are facing, some of the impact of globalization on Malaysian families, the role of the government vis-a-vis the Ministry of Women, Family and Community Development, and my organization, which is an agency under the ministry, the National Population and Family Development Board, and its role in family development, The way forward some ideas or suggestions for us to consider, and that's basically the context of my presentation. If you look at our profile of population in Malaysia, we see we are a fairly young population, which is about 28 million people, and most of the population is in the about 30% is in below 12 years of age. Then we have the working age population, but we are going towards an aging society as well. In terms of participation, population growth rate is about 2.3% based on our latest census, and the median age of the population is about 25 years. One of the changes which we are facing is that the mean age of marriage has also gone up. It's about 28 years for males and about 26 for females. In terms of nuclear families, we find that more and more families are nuclear as they migrate to the cities and the urban areas. Then we find that, and this will have an impact on the family structure as well. And the household size is also on a downward trend. And the number of working women is about 48 to 49% in the labor force. Out of these, about 58% of the women are married. So, ladies and gentlemen, some of the changing family structures or types that we are seeing today emerging is the conventional families, where you had more extended families, is on a downward trend. We have also single-member households. But the new types of family structures which we are seeing are dual career families, that we have both the husbands and wives working, commuter families who work away and meet maybe during weekends or during the monthly periods, blended families. This is due to single parent families, divorce, separation, etc. And then sandwich families, because we are going towards the aging population, the increased age at marriage, etc. So you find families who have to take care of their older family members or their parents as well as their young children. So they have this double responsibilities of looking at both the needs of both generations. And when we say touch and go, because of career needs, you hardly meet each other or you work on shifts and all that. So we call that touch and go. It's the card that we use when we travel on our highways. So you just swipe your card and go. So it's touch and go type of families. Solely a Malaysian creation. Double income, no kids. This is what's we are also looking probably in the next. We try to avoid that trend, but it may come to our shores as well, where people may look at getting married but maybe no kids. And we're also looking at a lot of families who are vulnerable to many challenges due to globalization. Okay, just a synopsis of some of the core problems which we are facing today among families. When we talk about families and problems and challenges, they are not very different the world over. Some of the common ones are related to changing values, structure, pressures of complex family responsibilities, and lack of support system. And as families struggle to solve their problems and are constantly looking for new approaches and skills to make their families function better and be resilient. The big challenge, ladies and gentlemen, is how to sustain and maintain a healthy family institution. A family that is strong and healthy is manifested in its functioning. The inability of families to adjust and cope with the challenges and demands of a rapidly changing environment has indirectly contributed to family instability and dysfunction, as well as the social problems plaguing our society today. Thus, many of our government plans, programs are focusing on people as a center of development. People is the main core focus. We want a balanced development, economic as well as societal or social development. And these are some of the issues which we have looked at it from the perspective of the family life cycle. And at every cycle, we see, even at children, we have issues like abuse, neglect. Then among the adolescents, we have issues like out of wedlock births, because of the challenges of introducing sexuality education. There's a big ongoing debate, but thankfully we have managed to look at it from the reproductive health perspective, and we are going into programs to help youth to be equipped with skills and knowledge and how to deal with social issues, drug issues, impact of ICT and media, influence of foreign values, etc. So we cannot we have to help them cope with the challenges that they are facing, and that's where we have our education programs. If you look at husband and wives, we have the relationship, infidelity, divorce becoming an issue, as well as relationship problems because of the pressures of both of them working. Parents, based on research, they say they are having problems dealing with their adolescents, financial issues, and work-life balance issues. These are some of the core issues that they say they face, and they need some skills to deal with. Among the elderly as well, we find that they complain of loneliness because of their old structure where it was extended family, and now quite a number of them are staying on their own or with their spouse. So an issue of loneliness, financial stability, as well as health issues. So these are some of the challenges which are confronting us today. In terms of globalization, just to recap what I just said, we need to continuously recognize and uphold the institution of family, and we make sure that is holistic development of the individual and the family as well. We need to look at issues of work-life balance, and we have different forms of family structures, so interventions have to be tailored to meet the needs of different family structures, and societal support and delivery systems need to be enhanced to help families cope with their challenges. Some additional challenges, as I mentioned, in globalization has a very widespread impact and cuts across every area of your life. And more efforts are needed to facilitate women entering the workforce. If you look at our universities, almost 68% are women, but we find that a lot of them tend to quit the workforce after a certain number of years, and some of the challenges they face is especially childcare support facilities, family responsibilities, or some say their husbands want them to quit and all that. So we need to have the support system to enable them to contribute to the economic development of the country as well. And these are some of the issues of crimes, domestic violence, increase in HIV/AIDS, etc., which is also becoming more rampant in our society. Ladies and gentlemen, family is, we look at family very seriously, and we consider them as, and we look in terms of context of the Universal Declaration of Human Rights, Section 16, which says that a family is entitled to protection by society and the state. So hence, the government is very serious and concerned about the challenges which are facing the family institution in Malaysia. As we know, the family is the one which provides the basic needs of the individual for food, shelter, care, besides education, health and welfare. The family is the agent which plays the primary role in laying the foundation for a healthy community, society and nation. However, when families break down and fail to provide the support for their members, the effects reverberate across society. So we need to look at family and make sure we provide the necessary interventions and support to our family institution. Let me go into some of the, in the context of time, I'll be a little bit brief, but Malaysia is one of the few countries, I would say, that has come out with a very explicit policy on family, which is the National Family Policy, which was out in 2011. And its focus, goal is to develop prosperous, healthy and resilient families to ensure social stability. The three strategic thrusts of the family policy is to increase the commitment and involvement of various stakeholders and to prioritize the family perspective in all national development efforts. The second perspective is to ensure that policies, procedures and enforcement of laws prioritize the family perspective. So we are going to look at existing laws, regulations and policies to make sure they are family friendly. And the third trust is to ensure that programs, services and family friendly facilities are accessible to everybody. So these are the goals of the National Family Policy, and we have a lot of players. We use the 3P perspective or strategy, where the people, the public and the private sector are all involved in ensuring the implementation of the National Family Policy Plan of Action. Excuse me. Okay, next. We also come up with many family-friendly initiatives to support the family institution, 90 days of paid maternity leave in the government sector, paternity leave as well, 7 days for fathers to take care of their wife and newborn child, but we hope they don't abuse that privilege and go golf or fishing or something like that. Paid compassionate leave if any family member dies, flexible working hours, creche at the workplace, subsidies for childcare. We provide a certain subsidy for the lower income public sectors, civil servants, and tax deductions as well. These are some of the latest policies that came out in our budget 2014, looking at more flexi working arrangements, economic empowerment, and childcare center at workplace. Excuse me. Okay. One Malaysia Family First is a movement to develop prosperous, healthy and resilient families to ensure social stability. And this is the brainchild of none other than our Prime Minister. He feels that all government agencies will work with the private sector to implement programs to strengthen the family institution. And it was a program that out of this program we also have National Family Month, which is in the month of November, where we have various family activities and programs conducted. Excuse me. So everybody is to increase the commitment on family issues and family agenda. In terms of programs, we also have strengthening of marriage institution, a Smart Start pre-marriage program, which is provided free to encourage couples who are going to get married to go for this program. And it's a 2-day program. We empower NGOs to conduct this program for us, trained facilitators, so that because the foundation of a strong family depends on a strong marriage, so we start with the marriage and to strengthen the marital relationship before they can in turn empower and strengthen their family institution. In addition to this, we have also many other family education programs. One interesting program is the Parenting at Work program, is to help couples, especially dual career couples, to deal with their work-life balance challenges and issues. And we also do it at the workplace, and the intention of this program is to get more males on board, because normally when we conduct our sorry, very bad throat. When we conduct our parenting programs, it's usually women who come. More than 70-80% are women. So when we do this program, we tell the employers, you must get at least 40% of your participants must be males, and we have succeeded in doing that. If not, men tend to go for financial management, computer, strategic planning, etc. But you say this is equally important, and you have to go for these courses as well. On adolescent reproductive health, we have programs in schools as well as in our national service program to equip adolescents with the right reproductive health skills so that they can cope with their challenges as well. And we have some outreach programs called the Cafe at Teen program at our centers as well. Besides this, we have also come up with a lot of family support services. We have one-stop family centers which we provide all the services that are listed, like counseling, programs, training of trainers, and we allow NGOs and whoever wants to use the facilities to conduct their programs as well. We do home visits and conduct counseling services, mediation, etc. as well throughout the country. We have about 58 centers. Okay, I'd just like to share before I end. We also have come up with a Malaysian Family Wellbeing Index. Again, one of the, I think, one of the first few countries who have come out with this Malaysian Family Wellbeing Index, so that we can measure and evaluate how we are doing in terms of the programs, policies, and its impact on the family institution. And just to share with you, the main objective of this Family Wellbeing Index was to build a set of indicators to measure the well-being of Malaysian families. Sometimes we get issues of telling us what is your return of investment. If you are saying you are effective, why do you still have social problems and all that? So we need to have some, although we can tell them about its intangible results, but we also have to have some statistical information to prove that we need a lot of resources to help families strengthen. To monitor family well-being trends, and as well as to identify priorities for action. Just to share, our well-being definition is a holistic definition, and well-being which covers many specific areas. This is a sort of a definition that works well for Malaysia, and in terms of family satisfaction, happiness, good family interaction, family functioning, and family resilience. These are some of the core areas which we find they are quite important if you want to strengthen Malaysian families. Based on our index, these are some of the domains. There were 7 key domains with 23 indicators which we used. One of them was family relationships, family economy, family health, family safety, family community, family and religion and spirituality, housing and environment. Which were based on a lot of engagement with the public, the universities, with families, etc. This is based on getting feedback as well, and we found that for Malaysia at this moment, these are some of the core domains which were found to be significant to Malaysian families and which had an impact on their family well-being. In terms of our index, this is the score which we got. The Family Wellbeing Index score was 7.55 out of 10, and it's a work in progress. We hope to go higher, but we found that, which is true based on other data as well, that the family's economic situation had almost the lowest score of 6.9, and that's true with the higher cost of living. We need to look at that as well. But religion had the highest score of 8.25, which is again what is their importance given to religion. Community, in terms of their involvement in their community participation. Family safety, if we look at socially what are some of the issues, so that it didn't do that well as well. And family health in terms of, thank you, I'm ending. Okay, so just to summarize some of the, thank you so much, some of the challenges we would look at in terms of, for us, in terms of planning our programs, would be initiating more family-friendly policies that promote work-life balance, changing family systems and its consequences, more research as well, and the impact of globalization. Maybe we need to do more studies and find out what more we can help to address these challenges, and financial management programs. The way forward, what we need to do would be look at lessons from existing programs, enhance existing programs or improve on them, utilization of social media as well to strengthen families, resource mobilization, to be alert to emerging trends, and improve monitoring and evaluation. In terms of our outcome, this is what we expect. Family well-being towards social stability. Excuse me, sorry. So these are the 6 areas we are looking: family perspective, family values, strengthening the family institution, meeting the parenting needs of families, strong foundations for adolescents, and family support services. We hope to be a high-income country with a very high happiness index, hopefully by 2020. So maybe from 7.55 we go to 9 maybe, or even 10. And in conclusion, I just say thank you very much for your attention. Sorry for my voice trouble. Thanks.
Thank you, Dr. Anjli. That was very impressive, and your country is quite progressive in many of the areas in terms of striking that work-family balance, and so we look forward to hearing more about it.